talking about pregnancy. I know that was a main issue this week with a number of people sending us questions with regard to, what happens when, if I'm pregnant and I get COVID, and to help us understand that and to answer some of these questions, of course, we have Dr. Erica Wheeler, PAHO, WHO Country Representative, Trinidad and Tobago, and of course the Dutch Caribbean, the Dutch Kingdom Islands. And Dr. Sally Ann Ishmael, head of the department, acting head of the department of the OBGYN Department at the POS General Hospital. Good morning to you both.
Good morning.
Good morning.
So let me start first with Dr. Ishmael with regard, because we've been having, I know you spoke about it at a press conference earlier, and we've been inundated with questions. But let's start at the beginning. How worried should pregnant women be at this time?
Well, thanks for having me to start with. Pregnant women are at no different risk of contracting COVID-19 than the general population. That's the first thing that they should know and understand. If you are a healthy woman and you have a normal pregnancy, then the risk of becoming severely ill as a result of COVID is going to be extremely small. If you are infected, you are still more likely to have no symptoms or to have mild illness and make a full recovery from it.
Yes. And what about but what about the delivery now? Because I know some women were asking about delivery. What happens with the child and what happens with aftercare?
Well, I can tell you that delivery is something that is extremely dynamic. Pregnancy itself is something that is extremely dynamic. Mm-hmm. And COVID aside, there is no guarantee that can be given to any pregnant woman. Mm-hmm. But if you do have suspected COVID, there are precautions that will be in place that will facilitate you having a normal delivery as possible. But of course, that depends on the extent of your symptomatology, the extent of the symptoms that you have. For all intents and purposes, delivery and the process of delivery would be undertaken in as normal a way as possible.
Yes. Are clinics still running, and what precautions are being taken at the clinics?
Well, each RHA will be functioning slightly differently, but with the intent to maintain social distancing so as to protect the patients, their families, and, of course, the healthcare workers concerned. Mm-hmm. So there are going to be some changes, but the intention here, of course, is not to disrupt the antenatal service to any great extent. Antenatal care is particularly important because of the potential changes that can happen, as we mentioned before. So it is extremely vital that the pregnant woman keeps her antenatal clinic visits, and she has to liaise with her healthcare providers to make sure that her clinics, which will be changed, clinic times will be changed, and she must liaise with her healthcare providers to ensure that she's abreast of those changes.
Let me ask Dr. Wheeler to weigh in. I'm going to come back to you, Dr. Ishmael. Dr. Wheeler, from the WHO perspective, are there any further guidelines with regard to how pregnant women are treated at this time?
Okay, so I think in addition to what Dr. Ishmael said, for breastfeeding, for example, after delivery, if the woman has COVID-19, we would recommend that she uses a mask for any close contact with the baby. Mm-hmm. So it does not mean that she should not breastfeed, but that she should take all the necessary precautions as anyone else who has COVID-19.
Right.
I think there might also be the issue of whether the father can be present in the room. Yes, again, but masked. So I think the message we need to get across is that we don't need to treat pregnant women differently from everyone else. And again, as Dr. Ishmael said, it depends on whether the disease is mild or it's not mild with the pregnant woman. So she would be treated just like everyone else. But I think all of the necessary hygiene precautions, as we give to everyone else, for herself and for her household,
Yes.
and the use of the mask while breastfeeding and while having close contact with her baby, because that continues to be very important for bonding.
And when you say treated as everyone else, one of the questions that we have received is about quarantine. Would she be quarantined, say, with other patients or other persons? Is it expected to be once she's positive?
But once she's positive again, it's a case of self-isolation, because she can do self-isolation in her home
Mm-hmm.
and take the precautions of not mixing utensils with the rest of the household, having her own space, ensuring that everything that she touches or uses is wiped clean. Those are the kinds of things we recommend for members of the population as well. Of course, once any individual realizes that they have symptoms that need medical care, certainly they
Yes.
need to call the hotline, contact their doctor.
Mm-hmm.
But the pregnant woman can self isolate as well in her own environment. Again, maybe Dr. Ishmael can deal with the different stages of her pregnancy as to when she should come into hospital and under what conditions. But self-isolation is also something that she can do in her own environment.
Yeah, Dr. Ishmael?
Yes, well, with respect to the symptoms of COVID, the one particular thing the pregnant woman will need to pay close attention to is fever. Once a fever develops, it is particularly important to act on it as quickly as possible, as readily as possible, by using simple medication like paracetamol in the form of Panadol or Tylenol. If the symptoms persist, then it would be important to liaise again with her healthcare provider to seek advice as to how to attend or whether she should attend and where she should attend.
Right. And then speaking about where they should attend, what about delivery now? There are questions about whether persons will be allowed to deliver at home if that was their preference from the start, at a private hospital, or would they all need to be in the public system?
Well, home births are not being recommended internationally at this time, and because we're following international guidelines and standards, we would not be recommending a home birth at this particular point in time. Mm-hmm. Private hospitals are referring all cases to the public system because this, of course, is a public health care matter.
Yes.
And COVID-19, like any other viral illness in pregnancy, does have the potential for complications during the pregnancy. Mm-hmm. So during the delivery process, like any other delivery process, intensive monitoring, would need to be implemented. And this is best done in a situation like a public health care setting as opposed to a home birth setting.
Can we talk a bit about the procedure now? Let's dial back a bit. If a woman is tested positive for COVID or suspected of COVID, what's the procedure? If it's suspected and she goes in to be tested, is she going through, triage, the tent system situation, or would she be put in a separate space? What's the procedure right now?
Well, each RHA has their own protocol for this particular process. And some of us actually have a direct entry modality for most of our pregnant women that allows them to bypass the accidents and emergency department. But it would be best for the patient to actually look at the Ministry of Health website for specific contacts where they can get most of the information for this pertaining to their particular RHA.
Mm-hmm. And is there a specific treatment besides, you mentioned Panadol, Tylenol, I know paracetamol, but is there any particular treatment besides that specifically for pregnant women, or it's the same as for everyone else?
No, it's the same for everyone else at this particular point in time. Remember, data is particularly limited with respect to COVID as a whole, and even more so with respect to COVID-positive pregnant women.
Yes.
And so far, treatment is basically is dependent on the degree of symptoms that you have, and of course, with respect to literally just treating the symptoms in essence.
What is the treatment for a baby who's born with COVID-19, or is that possible for a baby to be born with COVID-19? I think the question was, can it be transmitted from the mom to the baby, and what's the treatment?
Well, again, there is very limited data, so we are basically changing our protocols, and we are learning a lot more about this virus as you know, more and more people get infected. So the cohort of patients that are actually affected, that are pregnant and positive, is extremely small. So we're drawing upon that information. Ultimately, from the information that we have, there is limited supporting evidence to suggest that the baby actually acquires the infection during pregnancy or during labor.
Yes.
And there are cases where infants are presumed to have been infected, but those investigative processes are ongoing, so a definitive comment can't be made. But of course, as that information becomes available, you know, we will adapt our policies accordingly.
Yeah.
At this particular juncture, it is important to note that the virus has not been shown at all to have any harmful effect in terms of the development of the baby. And there is no evidence to suggest that it is in any way transmitted into the breast milk.
Right.
And as Dr. Wheeler alluded to, that is particularly important because we are advocating breastfeeding.
Dr. Wheeler, the emotional health of the pregnant woman now, what do you advise on that? Because I think there would be some anxieties. Already you were anxious about the baby, and now the added anxiety about COVID-19. And, you know, if you're not living with just you and a spouse, it's a big family. Should you move into your own room just because you are pregnant? Should you isolate yourself or separate yourself from the rest of the family?
You mean simply because you are pregnant
Yes.
and you don't show any signs? No.
Okay.
We are still at the stage where we are saying that once you do not have COVID-19, there is no need for you to be worried. Of course, you have to take all the necessary precautions, as we keep telling persons about their hand hygiene, their cough hygiene. Pregnant women, of course, need to be extra careful in terms of making sure that they observe all of these precautions, but they do not need to isolate themselves from society because they're pregnant. Pregnancy is not in itself a disease, of course. There's nothing to say that a pregnant woman should isolate herself. It is only if she has COVID-19, then she has to take all of the necessary precautions. Certainly, we keep telling persons that they should keep themselves abreast of all of the latest information. There's the government website they can go to, there's the PAHO website. Their family and friends can help them go to these websites, help them be informed, reassure them. At this time, yes, we understand that people are worried, but the antidote to worry is to take the necessary precautions and to stay informed.
Yes.
Don't just listen to anything you hear on social media. Make sure you get the correct information. Speak to your doctor. That is something that you can do. Call the clinic, speak to the nurse. So there's no need to be extra anxious simply because you are pregnant.
Right. And Dr. Ishmael, in terms of support now, psychological support, is there anything in place for persons who may be anxious at the hospital? I know there's something in place based on what came out at the press conference for persons who are at Cora and so on, but just on a regular basis.
Well, we do have, the simplest way of dealing with anxiety and stress is by asking questions. So I would always advise that any pregnant woman that is attending clinic, that is talking to her healthcare providers, ask questions and make sure that you understand. Make sure that you are happy with the answers that you get, and indulge. That's one of the first ways to alleviate any fears. And if the stress relates to financial circumstances or emotional circumstances, then we have support services that are available to provide that psychological support in each RHA.
All right, then I want to thank you. You're going to have to leave it there. Dr. Sally Ann Ishmael, acting head of department, OBGYN Department at POS General Hospital, and Dr. Erica Wheeler, PAHO WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. Thank you both for joining us. And this is where we say thank you to Guardian Group for bringing us another segment of Coping with COVID.
Coping with COVID-19, brought to you by Guardian Group. Live easy.